Keeping safety top of mind, the COVID-19 pandemic caused many medical practices to pivot their approach to outpatient care. This often meant embracing telemedicine, which experienced a digital revolution during the pandemic. Now, video conferencing telemedicine portals are more easily accessible for patients with respiratory issues, allowing them to communicate and receive care from their healthcare practitioners, or HCPs. So, which patients should HCPs consider for telemedicine? Telemedicine may be considered for patients who are 1. Already on a treatment plan, and 2. Living with chronic stable respiratory conditions such as asthma, COPD, interstitial lung disease, obstructive sleep apnea. Since aspects of these conditions may be managed remotely, telemedicine offers a variety of benefits, including reducing risks of exposure to all parties, allowing multiple healthcare providers and family members, caregivers to participate, allowing for remote evaluation of the home environment, medications, inhalers, and other equipment, reducing logistical hurdles such as taking time off work, finding childcare, and the need to travel for patients with limited mobility. Providers can assess whether patients need to visit a nearby clinic or hospital urgently. Symptoms, physical functioning, and emotional and social well-being may be monitored using standardized, validated questionnaires, such as the Asthma Control Test, COPD Assessment Test, King's Brief Interstitial Lung Disease Questionnaire, or Berlin Questionnaire for sleep apnea. Questionnaires may be sent electronically to the patient before a visit, so the results are available to aid clinical decision-making when the patient is seen. Monitoring these conditions remotely may also involve devices such as CPAP machines, pulse oximeters, smart inhalers, and even portable spirometry. However, for patients experiencing acute symptoms such as chest pain, shortness of breath, confusion, or other serious symptoms, it is recommended they seek in-person medical attention as soon as possible. When discussing telemedicine with your respiratory patients, it is important to consider the potential drawbacks to meeting virtually. Is the patient's condition and diagnosis right for telemedicine? Does the patient have reliable internet and the proficiency to access the telemedicine software? Will the patient's insurance cover telemedicine visits? Will a virtual visit be sufficient, or will this appointment require a physical exam? If you have not yet met in person, will you be able to establish a strong patient-HCP relationship? If telemedicine is the best approach for the patient with chronic, stable respiratory conditions, then before offering the appointment and gaining informed consent from the patient, it is critical that the HCP understand the local, state, and federal laws and regulations of telemedicine, as well as the HIPAA compliance software or web-based interface to make the most of the visit. With the help of advances in technology, telemedicine can provide flexibility for your patients both during and beyond the pandemic. Discuss the benefits and risks with your patients to determine an approach that works best for them.